anniversary reactions are a form of intrusion. Repeat pregnancies and repeat abortions are a form of intrusion. It's a symptom of trauma. So if you work in a crisis pregnancy center and a girl's come in there with her 4th crisis pregnancy, you know she needs healing. In fact, if you want to cut abortion in half tomorrow, engage in healing, because that repetition compulsion will stop. And there's a, I think I taught that the last time I was here, understanding repeat abortions, not only as a traumatic reenactment, but as a way to tell your story again and again, and then a way to master your feelings about it. Because someone has their first abortion, it's very upsetting, but by the time you have your 10th or your 6th, it's not a big deal anymore. So in effect, your body has adjusted to the neurochemistry of that trauma and it feels normal. And that's the really scary part when people master their trauma. The most despicable things seem normal and acceptable. And then we want to brand it as healthcare, right? So risk-taking behavior is a symptom of intrusion. So it's part of the need to take a risk to release adrenaline, to medicate anxiety, because if you're about to shoplift, you feel wildly alive and there's all these chemicals, and this is why people are addicted to it, even though it puts them at risk. You know why? Because it makes them feel good. I learned about a sexual abuse program, I forget the name of it, in Florida, where they were having people jump out of planes and skydive as part of their trauma treatment so that they could feel victorious. But I'm sure it does make you feel pretty damn alive when you're flying out, hoping that a chute opens up. I only enjoy calculated risks that I know I can handle with no mechanical failure allowed. So that's risk-taking behavior. I had one patient who used to play this game she called Chicken, and she would drive her car with her eyes closed, traveling, 70 miles an hour, and she'd count to 10. And then she'd say, "What are you, chicken?" And then she would close her eyes and count to 20 and accelerate a little more. That's trauma. And other people will go out walking in Central Park in 2 a.m, just like rape me. This is why victims of trauma end up inviting more trauma, because they don't know how to keep themselves safe. And it's part of the chemistry, which we'll talk about in detail tomorrow, the neurochemistry. Suicidal impulses are a form of intrusion, and they're unwelcome images or scenarios that enter one's consciousness for no apparent reason, like intrusive thoughts, to feel like you want to kill yourself. It doesn't mean that you really want to kill yourself, but you can have the impulse to do it when you're overwhelmed with despair. So some people will envision themselves like suicidal ideation. They'll say they're driving down in their car really fast, and they'll just have this intrusive thought that they're going to turn the wheel and go off the side of a cliff. It's very powerful, very overwhelming, and they're like, why am I thinking that? Or they'll think that they want to go hurt somebody or kill somebody. And they're like, I would never do that. But it's called intrusive thought. One gal had the thought that she was going to poison her kids' food every morning. She would struggle with this whole fantasy that she was going to poison their food. She would imagine them reacting to the poison, being rushed to the hospital, and then the doctors would discover that she had done it and tried to do it on purpose. Then he'd tell the husband, she tried to kill the children, she shouldn't have them. Do you hear this whole scenario? What's happening here? I review her life. She came to me for panic and anxiety many years ago, and I asked her to tell me about her history, and she shared that she had a saline abortion. I asked how a saline abortion worked, and she described it as a poisoning of the fetus. So here she is in this intrusive thought, totally unrelated and not connected at all to any abortion being traumatic, because a lot of people will say, I'm fine for it. But when you really hear about their life, you hear about all these other things. That's where they're reliving their trauma. That's where they're living the shame of being discovered, of the husband being told she shouldn't have the kids, she tried to kill them, of all the themes related to her painful loss. And after she did grief work, every episode was clustered around the shameful aftermath of killing. And after her Rachel's Vineyard, all those thoughts stopped. That's the good news. Obsessive things that people can be imprisoned by for many years that make you hate yourself. Who wants to have thoughts of hurting their children? It's really disturbing, and it makes women afraid to be near their kids sometimes. Or then they're acting out of the pain of that, is that I'm a bad mother, and they're doing everything, including sometimes abuse, to keep validating that feeling and feel guilty. So other intrusive thoughts can be related to obsessions with death. Fear of the baby dying when you have a wanted child. And my best friend, Mary Beth, is a nurse that works with women in high-risk pregnancy. And all of these women have, on their previous abortions, and they're called VIP patients, which means voluntary interruption of pregnancy in their reproductive history. That's VIP. So she knows they've had abortions. They're in high-risk pregnancies because usually of incompetent cervix. Incompetent cervix is the cause for premature birth, and it's a side effect of abortion, especially multiple abortions. So as the baby grows, the tiny muscle fibers that are forced open in an abortion are torn and damaged. So the cervix can't hold the weight of a developing child, and there's premature delivery. So Mary Beth has them all on fetal monitors, and she watches the fetal monitors all day. When there's a lot of uterine activity, she'll call them up and say, "Get off your feet." And the girl's usually crying, and she says, she's crying and crying, thinking God's going to punish her because she can feel the contractions. And you know what? She's walking around. And this is it's supposed to be a cheaper way to keep people out of the hospital, but she's not allowed by her company to give any resources for post-abortion healing because they don't recognize that. And yet there's research coming out of the De Weber Institute up in Canada, does a lot of this research, and so does a hospital in New Zealand. And they're linking cerebral palsy, 1,133% increase in cerebral palsy directly to incompetent cervix. And that risk goes up with each abortion. So this is a very big concern in the African American community that has repeat abortions, in any community, but specifically with that because they've had a skyrocketing in disabled children. And then you can imagine when you do have a child with special needs with all those mother issues, it's just so painful. Compulsions are another form of intrusion, and that's like the OCD kind of behaviors that you didn't have before the trauma. Because there's regular OCD, and then there's obsessive compulsive disorder that develops afterwards. So the rituals of checking, washing, confessing, doing things over and over in a certain order is what we usually think of. I know a lot of people who feel that they're dirty. They will sit in the shower and scrub until they bleed because they feel dirty. Other people become cleaning fanatics, and one girl used to wash her kitchen floor every day, which I saw as a serious mental illness. But it was very sad because she exhausted herself, but it's a ritual that binded anxiety, and it was serving a purpose because she said it was so, and we talked about her abortion, she said it was so important for me to look perfect. I didn't want anyone to know what I had done. And Kimmy said the same thing. Her hair, everything had to look in place to compensate for what she was feeling inside, which was disgusting. So she wanted everybody else, and you are beautiful, with or without the beautiful hair. But so the compulsions is a symptom of intrusion. And the other thing is that any cleaning person becomes a slave to their conscience, trying to tidy up the dirty emotions that they feel inside. And so the kitchen floor, the toilet, the rugs, everything she cleaned was symbolic of something contaminated that needed to be cleansed. And this is a metaphor for her soul. And when we do work of healing, it's really a therapy for the soul, because we're looking at issues of death, of reconciliation, forgiveness, of yourself, of others that were involved. And so it has to become a spiritual journey. I don't know any other way to do it. And I can do it for people that don't want a faith-based, but I don't accomplish near as what I would when people are allowed to use their faith. And we'll talk about that later. Constriction is the last form, and that's the numbing of one's emotions or behaviors, and that's designed to avoid sight, sound, smells, or any feelings associated with the trauma. It's marked by feelings of helplessness. So an inability to call the abortion is a form of constriction. You have no memory of it, you completely block it out. And there are people that forgot they even had one. Did you know that? They might feel compelled to help people and organize a post-abortion retreat. That's why we make everybody participate, because I've seen it happen that 3 days into the retreat, the organizer suddenly has all these repressed memories. Alcohol and drug abuse is another form of constriction that's very accessible. Avoiding situations that might remind you of the trauma. This is where avoiding children, not having children, becoming lesbian, these are all linked to abortion trauma. I also know many men who become homosexuals because they don't feel safe around women. Their mother might have had a lot of post-abortion trauma, going into rages, screaming and yelling, and one boy that ended up becoming homosexual, he had all these memories we were dealing with in therapy of hiding in a closet, cowering, fearful that his mom was going to come. So, there's a lot of causes, but trauma can drive sexual preference. Withdrawal from relationships is another form of constriction, and avoidance of children, I said. Restricted affect is a form of constrictive. That's that zombie nation. That's that you just don't feel anything. You're never really happy. You're never really sad. You're just in that zoned out zombie, don't feel anything. And this is why people cut. We'll talk about that. And suicide is the ultimate constriction. Rates of suicide go 600% after abortion. And a lot of teenagers are at super high risk for suicide within a year after their abortion. So this is the vicious cycle of PTSD, where the intrusion, the subconscious draws attention to the pain. You usually don't connect the dots there. Hyperarousal is where your body goes on full alert, and constriction is where you want to put the lid on all that bubbling stew and shut it all down because you can't take it and it's very threatening. Hyperarousal is marked by very high levels of emotion. Constriction is the numb emotion, and this reflects the approach avoidance. It takes a lot of energy. If I had an analogy, it's trying to swim with a big giant beach ball that you're trying to hide from everybody. So you're going to push that beach ball down. Your feet are going to be going like crazy to keep your balance. Oh, and guess what? You have to use your other hand to wave to everybody to make it look like everything's fine. Hi. When there's all this stuff going on. Exhausting. Exhausting. This is why people get sick. So here's your pop quiz, because we have 5 minutes for this. When I was in supervision, and I'll tell this story tomorrow, my supervisor gave me a book called With Child. I was pregnant with my first child. It was written by Phyllis Chesler. Phyllis Chesler wrote the book Women in Madness. It's about this thick. It's a history of women's insanity throughout the ages. Good read. And and she recently wrote Women's Inhumanity to Women. But one of her books that she had just written was With Child, and that was a diary of motherhood. I'm talking 30 years ago. I'm pregnant with my first child. And she gives me this book, my supervisor from Penn, who later kicked me out of supervision, and I'll tell that story tomorrow probably. So she gives me this book, and I really believe she was a patient of my supervisor, because Phyllis was a professor at Westchester, and it was autographed to me saying, "To Teresa, happy motherhood." So I want to read some excerpts from that book, and we're going to diagnose her. Phyllis had 4 abortions before she decided to carry her son Ariel to term, and she's writing this book. She said, "My teeth are chattering, my fear, such fear, rise up out of my history to swirl through my bowels all the way to my teeth. I'm afraid of you." She's writing to the baby. "Who are you that I tremble so?" What's that a symptom of? Yes. "I can't even seem to get through a book. My eyes hurt, my attention wanders. I can't even watch a television program from beginning to end." What's that? Hyperarousal, it's the inability to concentrate. People can't watch a movie. They might sit there, they're taking nothing in. "What if you're born monstrous with my anger, my excesses? What if you're stillborn? What if you're killed by some hospital procedure?" What's all that? Intrusion. "Should I heat a cauldron water, cut your cord with my bloody teeth? I have no one to talk about all this. Women's smiles are fixed grins, the mask of silence. I know they smell my fear. They don't want to remember their own. They keep their distance. What's happening here? It's intrusion, and she's also isolated. She can't talk about it to anybody, and she's feeling like a witch. The bloody cauldron water. How can I be so frightened of you? You're so tiny. I'm more frightened of you than anyone I know. It's the fear and intrusion that her baby's a threat. Why? Because her baby's going to bring up other memories she doesn't want to remember. This is at the heart of some of the traumatic bonding that goes on. When your baby is a trigger, when you're afraid of your own baby, how do you successfully and normally bond with a child? And bonding is critical for their development and their security in the world. And she says, I see an internist. Do I have anemia, a malfunctioning thyroid again? I have my eyes checked too. Given birth has shaken my vision, literally. She's running around from doctor to doctor to doctor because everything in her is screaming, something's wrong with me, something's wrong with me. And there's been research that shows that after an abortion, trips to the ER spike, usually because people think they have a brain tumor or a heart attack or whatever. And the moms who take daughters for abortions have the same symptoms going into all these things. And we know this from record-based studies. So you see a big spike in all these trips to the ER and all these doctor office visits to specialists out the wazoo because something's wrong. And she's doing the same thing here. The word pregnancy, as I repeat it aloud, still bears the weight of female fear and punishment. Pregnancy as in, did she do it? Is it legal? Pregnant as in, mishappened, swollen. Maybe it's Rosemary's Baby in there. For anybody that doesn't know that movie, it was about where the baby's a demon. And so the demonization of children, the demonization of babies in all the Freddy Krueger movies and all those things is really where it's coming out in the art, in the movies, in the songs, where children are to be feared and destroyed because of the trauma, right? So no one realizes I mean to kill myself. I imagine all the ways that you can die, and then I cry for you. So she's having thoughts of suicide and infanticide, and that's intrusion. Ariel, I imagine all the ways that I can kill you. I can drown you in the bathtub. I can smother you with a pillow. I can bang your head on the floor once hard. This is so painful because it should be a beautiful, miraculous, loving time in a woman's life to have the gift of a child. And because of the trauma, everything is twisted into this disturbing thing. She said, last night I wept when I heard about a baby crying. This month I do the killing. I kill and I tremble in horror. Why such images? My life is gone. There's only us, with you always first. Who's she getting mad at now? So sad, isn't it? Quite intrusion. They've begun again. Have they ever stopped? The moving pictures of your violent death. What are moving pictures? Flashbacks. She's having flashbacks all over the place. You fall on your head splits open, you cough, you turn blue before my eyes. One morning, you simply don't wake up. You drown in an inch of bathwater, you're hit by a car. There's more blood now than when you were born. I look away, I squeeze my eyes shut. Major intrusiveness, huh? Of what? What are we talking about here? Her baby's dying. Her baby's dying. That's the theme that she's reliving in this next wanted child. I jump at whispers. What's that? Exaggerated startle response. Hyperarousal. I'm expected to respond constantly. It's beyond my capacity. My entire system is geared for alarm, for emergency. But I'm paralyzed. This is the heart of PTSD, and we're going to talk about the chemicals that cause this tomorrow. To be all geared up and ready to take action, but you can't move. I'm too sensitive to be in charge of a baby. I'm unfit. How can I protect you in my weakened state? And now we've gone to the very core of her identity as a mother. Her ability to care for and protect her child is seriously in question. This is not good for our society. I have all the symptoms of battle fatigue. What's battle fatigue? Post-traumatic stress disorder. She's diagnosed herself When I insist I'm depressed, suicidal, my friends look worried and look away. I drink too much tonight. She drank throughout her pregnancy, Manhattans, highballs, all of it. Last night, you woke up screaming. Was it a nightmare? Are you reliving a previous death? The sound was eerie, gripping, an innocent infant crying out as though damned. These are the intrusive thoughts trying to bring her attention to the children that she's lost. And it actually works because in her diary she says, "Child, I've had 4 abortions. I could have been the mother of an 18-year-old, a 16-year-old, a 14-year-old, and a 7-year-old. And who would I be? Would I be myself? Would it matter if I weren't? Yes, it would. How much harder would it have been for me to, with a child, to wrench myself out of poverty, self-hatred? Could I have been a mother to myself if I had children? How lucky for both of us that I was able to act with such resolve each time." What do you think? Gloria Steinman extolled this book as providing myth-shattering insights that will affirm women's sanity. Of course she did. Gloria Steinem had the same things after her traumatic abortion. She had the same kind of thoughts. She never did marry or have children until she was like 72. I mean, she married finally, but she had an abortion in England on her way to cover a story in India, and right after her abortion, she jumped on a plane and went to India. She was still bleeding from her abortion, and the rest of her life she lived out of a suitcase, constantly going from place to place and couldn't settle down. That was her traumatic theme, so that's what she did at the time of her trauma and spent her life doing it. And really interesting stories about her that we don't have time for, but I think that to pattern horror into pregnancy as normal is very disturbing. And when we want to say that this affirms women's sanity, we're really going the wrong direction with any kind of feminism.